Hello, I'm Dr. Nguyễn Thanh Hiệp, Director of Phan Ngọc Thạch University of Medicine, or VTU. Our university was established in 1989 and has been a reputable school of medicine in Vietnam. VTU decided to establish a new clinical simulation center that conforms to the highest standards, not only to support its competency-based curriculum, but also to enhance the quality of education and the competency of the VTU learners. The construction of this center was started in May 2017 and completed in April 2018. The school board of managers had designated the name Center for Elaboration Competency and Innovation in Clinical Simulation (Cecics) in late 2017. With a total surface area of 16,200 square feet, the center is located on the top 3 floors of this 9-story building C of BTU. Our programs were accredited in teaching, education, and assessment in 2021, and now we are applying for SSS mid-cycle of accreditation in research. I am committed to supporting our faculty and staff who are dedicated to simulation-based research to improve patient care. I strongly support simulation research activities to investigate the impact of simulation on patient safety, interpersonal communication, and patient satisfaction. Welcome all of you to our Clinical Simulation Center Cecics BTU. Now, together with Dr. Thư, Director of the Cecics, we are welcome to invite you to tour our Clinical Simulation Center through this virtual video.
Now, we are on the 8th floor.
When the learner go to our centers, they will see the whiteboard with details of the classes during the day. For example, time, desk, room, and instructor. That will get them a good start, so they not wonder if they are late or which their room is.
Cecics takes the lead to serve the educational mission of UPNT and strives to achieve the vision in becoming one of the best institutes for clinical simulation in Southeast Asia. The program's mission and vision statements are clearly visible on our website and across the 3 floors of the Clinical Simulation Center to address the goals and objectives of our program to learners, staff, and the public. We are going to show you the assessor's room, so please follow me this way. In this room, all computers are connected to the CAE Learning Space, a clinical simulation management platform, and used by the assessors for formative and summative assessments of simulation activities. The assessors can observe the learners in the OSCE or exam rooms for their encounters with the standardized patients, mannequins, or part task trainers. Next to the assessor room are the administrative and executive board spaces. The administrative space includes 4 subdivisions: administration, education, technology, and research. The executive boardroom is reserved for the director and the associate director. You'll see frame photos of many well-known medical educators, physicians, scientists, and Cecics founders or supporters as we walk towards the OSCE room. We have a total of 18 OSCE rooms, 9 of which are on this floor, and the other 9 are on the 7th floor. You'll see one of these rooms in just a moment. The outside laptop computer is for the learners, and the inside laptop is for the standardized patients to input their observations. Both laptop computers are connected to the learning space. Each OSCE room is set up to resemble an examination room of our outpatient clinic. Our students come here to work with standardized patients, mannequins, or part task trainers to apply medical knowledge and practice different skills, such as communication or history-taking skills, as well as to improving their clinical decision-making. All simulation equipment or instruments are labeled simulation equipment and/or do not use for patient care. Next to the OSCE rooms is the preparation room or the classroom with a maximum capacity of 40 people for pre-briefing and/or debriefing for learners, staff development, or meetings. The room can be easily rearranged for small group debriefing. With the CAE Learning Space system, we can replay sessions for review and discussion during the debriefing. The server room housed the CAE Learning Space system on the 8th floor. Now, we will continue to have a look at some other floors in our center. Here we are on the 7th floor. And this is the room for our standardized patients. We have recruited a wonderful group of standardized patients, some of which are public actors. They are employed on a part-time or hourly basis and trained to portray a patient case. In the future, we will train the standardized patients to assess student performance and provide feedback on interpersonal skills, professionalism, as well as patient satisfaction. Now, we're going to the 9th floor to take a look at our simulation rooms. Simulation room number 1 is reserved for the simulation activities performed on the virtual reality simulators. At Cecics, advanced procedural simulation training on virtual reality simulators is reserved for the postgraduate trainees. In this simulation room, we have the following virtual reality simulators. 1. CAE Endo VR. 2. CAE Lab VR. 3. CAE Cath Lab VR. 4. Realistic simulation in point-of-care ultrasound and echocardiography. We will show you the control room, where behind the one-way glass, our faculty educators, assessors, and/or simulation specialists will monitor and control the mannequin's responses according to the learner's interventions. Now, we're going to simulation room number 2, where we install the birthing simulator, Laerdal SimMom. This is the place where our learners can practice obstetric skills individually or in small groups. On the top of the crash cart is a binder that has information on the content of the cart, including the medication administration record and a report of previous uses. In the first drawer, we put all simulation emergency medications for cardiac arrest, cardiac arrhythmias, allergic reactions, and/or antidotes such as Narcan. In the second drawer, we put some pediatric medications and IV fluids. In the third drawer, we store IV supplies including IV catheters, alcohol wipes, tape, tubing, and syringes. The fourth drawer stores intubation and respiratory equipment. In the last drawer, we put medical supplies such as central venous catheters, chest tubes, intraosseous kits, a suture set, and tourniquets. Simulation room number 3 is dedicated to pediatric care, where our learners will have the opportunity to demonstrate their competency in diagnosing and treating different medical conditions on a Laerdal Sim baby. Here is simulation room number 4. The simulation room can be set up according to the requested simulation scenario, whether it be a medical event in the emergency room or in the ICU. The simulation room is equipped with a Laerdal SimMan, a hospital bed, vital sign monitors, a crash cart, and a trolley for simulated medications. With the Laerdal SimMan, a high-fidelity mannequin, we can set up a scenario of a patient with a severe asthma attack and acute respiratory failure, or a scenario of a patient with cardiorespiratory arrest due to a heart attack. Medications used in all 4 simulation rooms are clearly labeled simulated medication and/or do not use for patient care. Simulation equipment or instruments are labeled simulation equipment and/or do not use for patient care. This is our partial task trainer room, where our students can learn and develop skills in a safe environment where they perform on patients. We can set up different types of clinical skills in this room. Here's a model for training in peripheral venous catheterization, urinary catheterization simulator, blood pressure measurement, radial arterial access, and airway management. Next, we will take you to the storage space. We have 2 storage rooms, a smaller one on the 7th floor, about 248 square feet, and a bigger one on the 9th floor, with a total surface area of 732 square feet. We have maximized the use of our storage space with 5 shelves, and they are organized by specialties or particular procedural skills. For example, obstetrics and gynecology skills, or internal medicine skills. We have many types of low, medium, and high fidelity models which are available for training. In this video, we have only shown you some of them, and we will provide the complete list of the equipment in the application.
We hope you enjoy the virtual video tour of our simulation center. Thank you very much
and
Goodbye.